So I will call the meeting to order. This is the Concord Board of Health meeting, Monday, September 23rd. We are in person and virtual and have some guests present on Zoom as well. Going through the agenda, we'll start, and present in person, I should say. I'm Randy Kring, I'm the chair of the Board of Health.
Jim Whalen, board member.
Dottie Bernard, board member.
I'm Melanie.
Yes.
I'm Melanie Deneen, the public health director.
Great.
Ebony, office coordinator.
Wonderful, excellent. And Kurt may be joining, but we have a quorum to proceed as it is, so.
Randy, I'm online actually tonight, sorry. It shows me as observer, I don't know why, but that's me here.
Hi Kurt, good to see you. Sorry, I didn't notice you there. Welcome.
Good to see you too, thank you.
Excellent, alrighty. So we'll start with the approval of the minutes. We have two sets of, I guess 3 sets of minutes to approve. The minutes from the regular meeting on July 16th, the minutes from the executive session on July 16th, and the minutes from our emergency meeting on September 14th, as we did not have a August meeting. So I would entertain a motion to approve the minutes from those 3 meetings, unless there are any edits that any of the board members would like to make.
I move to approve all 3 sets of minutes.
Great,
Second.
excellent. And all in favor?
All right.
And Kurt?
Hi,
Excellent. So minutes approved unanimously by the board. Wonderful. Next topic on the agenda is the public health nurse report.
And I'm gonna give that tonight.
Sounds good.
Maura was off today.
Sure thing.
We are in full swing with our public health needs assessment. I hope all of you have seen it on multiple forums. We did publish last week in the Concord Bridge. We have over 300 respondents in Concord, so we're happy with that. We'd like more. So please continue. We're going to continue with the public health needs assessment through the beginning of October. We'd like to be wrapping up mid-October at the latest, mostly because we have an intern from BU that we're going to be working on then the data and the reporting, and we'd like to use that help. But I did reach out a little bit, had some feedback from folks, some concerns about the content and security, and there's no traceability back to you. So I had some feedback from folks not wanting to, there's some personal questions, not your financial information, but about your well-being and your mental health that people were reticent about. And it's not, there's no way to track that back. Like we're not gonna connect it back to you. So if anybody talks to you about that, I did confirm. Lot other things going on for October is our flu clinic month. So Maura's worked hard with our partner Acton Pharmacy to set up. We have a Counts on Aging has a flu clinic on October 17th. We have an employee flu clinic. This year we're at the schools on October 9th, 2 to 2:30 specifically for school staff at their request, and then opened it all employees, including school staff, 2:30 to 4. So really hoping to get support the school town employees and then get participants there. We sent out a survey to town staff and school staff asking if they wanted the COVID shot. The COVID shot will be available, but to try to estimate numbers, less than 50% are saying that they also were going to get, if they're getting the flu shot, they're also going to get the COVID shot. And then the state is going to run a flu clinic at the Concord shelter on October 21st. The thing I wanted to make sure you guys knew, there is homebound vaccines available through our partners. Maura will schedule those with Acton Pharmacy. So if people send them to our office through her, or they can call the public health nurse directly to schedule anybody that's homebound. We've ordered more COVID tests. We have used up our supply. There are some more available. So we do have we're out right now, but we will have getting more in here in the health office. We distribute those to the Council on Aging through the library to the public and here if people are looking for them, but I don't have any right now. There was a little bit of, in August, as you will see from the numbers, there's a little bit of a COVID, I don't call it a surge, but increase in COVID numbers with people traveling and seeing folks and getting back to schools. And so we did go through our supply the end of August. So for the month of August, we had 32 positive cases of COVID. 16 cases of Lyme, 2 cases Salmonella, 1 case of Giardia, 2 cases Campylobacter, 1 Hep C, 1 Hep B. Maura was also busy outside of the public health needs in Nesson. We gave a Narcan training and recognition of our opioid awareness day on the evening of August 28th. We had about 8 community members come. We also want people to know that if anybody would like a one-on-one or a public Narcan training, we have the trainers and we have a presentation we give that's available. We've also been to the high school, one of the middle schools, and we're due to the last middle school for the Hidden Plain Sight initiative that's kind of talking about how to talk with your kids about substance use and some indicators. So it's a mock bedroom with possible paraphernalia and, tools and discussion for adults only at this point about substances. More on September 9th gave an advocacy training, like how to advocate for yourself in the healthcare world. That went over very, very well. So I think that's it. That's it. That completes the public health nursing report.
Excellent. Thank you very much.
No problem.
Alrighty, so the next topic on the agenda is a discussion amongst the board regarding EEE recommendation from the board. As you'll all recall from our emergency meeting, we gave as a board, a strong recommendation to restrict activities from dusk to dawn as per the general recommendations from the Department of Public Health. The update since that meeting a week and a half ago was that the mosquitoes last week in Concord that were tested in Concord tested negative for EEE. And so wanted to kind of bring up a discussion about should we modify our recommendation at all for the community. Important to note that the state does still designate Concord as a high-risk town for EEE. But the mosquito population is undoubtedly declining just because of the time of year. So I don't know, Melanie, and I see Tony's on Zoom as well. If either of you would like to just give share your thoughts as in the midst of it, so that we as the board can discuss.
Tony, do you want to go first? Do you want me to go? All right, so I'm gonna go. I did talk to Brian, our mosquito control superintendent, just a little bit of background last week. All samples, Sudbury, North Reading, Maynard, and Concord were all negative. So that's the week before the week of 9/9, Lexington, Wakefield, Concord, Bedford, and Burlington were tested. All the samples were negative, but Concord. So the week before, we were the only positive group. The numbers as of 9/16 were low, only about 20 to 25 total mosquito were caught, like to look at, so there's not a lot. Sort of balancing the information, we got a little bit of water, so, said mosquito populations were declining because it was dry and cold. Well, we got a little bit of water, so now are we going to have more this week? I heard from Brian that their entomologist was out, so I don't know if traps are up. They were maybe gonna collect tomorrow, but I have to confirm if there's one more week of sampling. And by the 1st of October, the state's not going to sample anymore. So you're in your rest level till frost, is what I've been told to date. Tony?
Yeah, so I concur. The numbers have continued to dwindle. The latest report, the sampling report came out statewide, and for every species that would be of risk, the numbers are way down, even below annual averages. So risk is declining, low and declining. And the rain that we got, it's too late in the season for that to make any difference. So I think we're it's on the way out. So
Is there any possibility of so just to clarify, so that the mosquito population you would anticipate would continue to decline in numbers at this time of year? There's not really a possibility of the population rebounding at this point.
Correct. Because of the temperatures and because of physiology, some mosquitoes switch to like an overwintering state, so they're not gonna, eggs don't hatch and development kind of diapause pauses development. So yeah, there's no recruitment going on right now. So there are some species that if the river's flooded, you could potentially trigger a hatch, but that didn't really happen with this event. So we're, yeah, we're out of the woods, I think, so to speak. We're getting there.
Awesome.
Mm.
Well, so just playing out kind of the possibilities of, what we can do as a board. So we could maintain our current recommendation to strongly recommend that activities be restricted from dusk to dawn. We could alternatively dial that back somewhat to say that activities don't need to be restricted, but personal protection should continue, and that I would say would be a minimum of what we should recommend, of course. So Melanie, so it's unclear if there'll be more testing this week or not?
Right, I
Okay.
had thought there would be last time I spoke to you, and then I
Yeah.
got an email today that the person was out today, and so I'm not, as of right now, I don't know. I should know tomorrow, but I can't
Yeah.
unfortunately tell you that right
Sure.
this minute.
Because where we could be chasing our tail, as it were, is if we do suggest, let's reduce the strength of our recommendation, and then the mosquitoes this week test positive. To hear, that the population is still dwindling or is continuing to drop, that obviously is a trend in the right direction, and so I think would still support the idea of changing our strength of our recommendation, but
Right, I
Yeah.
think if we go back and forth, that would be a challenge.
yes.
Probably
Let's
more
get-
concerned about a positive mosquito amongst 20 versus like a positive mosquito among 20,000, too,
Well,
so.
there's pool testing too, so they don't know, they test them. I don't think they test the mosquitoes individually.
Oh, I see, okay, yeah, gotcha, okay,
They would be too many tests.
yeah,
Like, but in the height of the summer, the number of mosquitoes is in the thousands versus we
Right.
got 25. It's a total different total number that go into the trap. That's, Tony knows more about it than me. I'm,
Right.
but I think that's,
The ones that are out there right now are probably riskier because they're older and they're more likely to be infected. So it's still, any mosquito you see is dangerous. So potentially, so.
Mhm.
Mm.
and I guess we're still low, but there is still West Nile, that way. So if you look at the map, we've got Triple E around us, and then on the other side of 128, which is just on the other side of Lincoln, there's a bunch of West Nile that is
Mhm.
getting higher in risk. So I think there's reason to use precautions for everyone, whether or not it warrants, curtailing nighttime and early morning activities. We've had some events that want to get started early in the morning in Concord. And then those folks are looking to not start till dawn. So it's like getting set up for like a road race or something like that. So there's been some, just discussion about what is appropriate.
yeah, we do continue with what we have, you said that there's probably very little chance that until the first frost, that everything kind of continues as is, so we wouldn't readdress this in
Right.
another month.
If we test this week and mosquitoes test negative and it continued, I would feel like by October 1st, I'd be comfortable, like, the risk is low to say that we don't recommend that anymore because of those less and less mosquitoes. I just don't. I think it's a back and forth. You go either way right now.
Mhm.
Right.
But I do think there is less risk if we have another week with no mosquitoes. In the whole region, there's no mosquitoes that are testing positive. Doesn't mean they're not out there. They're definitely out there. Like Tony says, I just think it's less likely.
So could we potentially decide as a board to if testing is happening this week, maintain our, you know, and make you think you'd be able to find out tomorrow? if
I hope so, yeah.
Okay.
I just
Sure.
don't know right
Yeah,
now. That
sure.
was a new, I was
Yes.
off earlier today, so I'm like catching up and
Yep.
then, oh, we're not gonna sorry about that. We're not gonna test today. Didn't happen.
Sure, sure.
So if testing is not happening this week, then we wouldn't have any new information
Correct.
to base our recommendation off of. And I think kind of hearing the trend of how things are going, I would feel comfortable with relaxing our recommendation. If there is testing this week, then waiting until we find out if those mosquitoes tested positive to relax our recommendation would probably make sense. Is that
A delayed.
a delayed, right? Yes.
Yeah, I think we could you could stay hot. You could choose to stay where we're at until the results and then if it's test positive, stay where we're at. And if it tests negative, then say, well, we're going to reduce. You could do it like that. That would be, you know, hopefully Thursday or Friday. If if they don't sample at all, I'll have to kind of.
And I think if they don't sample, and then there's not any more sampling happening after this week, either,
Right.
right? Then I would again feel comfortable kind of based on the trend of things to relax our recommendations as soon as we know there's not gonna be more testing.
Correct.
If, but open to thoughts, of course.
Oh,
Yeah.
I concur with that, yeah.
Yep.
I think that's great.
Yeah, I think that sounds reasonable. If we have more data and it shows the same trend, great. And if we don't, it seems like all the indicators are that it's going to be going in a positive direction.
Excellent. Okay. Any other thoughts from the board?
No,
Right, okay.
none for me,
Sure.
yeah.
Okay, all right, well, then I would entertain a motion to, I suppose authorize Melanie, if you're willing.
Yep.
That if there is testing this week, to maintain our current recommendation until we get the results of that
Okay.
testing. And if the testing, comes back negative, to then,
Change
change our recommendation to not, to maybe to remove the strong recommendation to.
Okay, that sounds good.
Lots of doubles, but yes. And if there is testing this week, to wait until the results, and act accordingly.
I move to authorize Melanie to take those two actions.
Wonderful. Okay, I have a second.
I second it.
Great. All right, and then all in favor, in person,
Bye.
aye, and Kurt?
Aye.
Excellent, so unanimously approved. And thank you, Melanie, for doing that, wonderful. Excellent, all right, so the next topic on the agenda is the chair and board member reports. Start with the chair report, I have really nothing additional to add. It's been busy, of course, with the Triple E, and that was kind of the big discussion at the chair's breakfast this month. Yeah, nothing additional for me. Any board member reports?
I attended my first meeting of the
Oh,
229
great.
committee. Very technical, so that was interesting to try to get up to speed on 2229. And the two big topics that I felt really came out of that meeting on Friday were the sampling. They are asking for a tighter sampling grid. That the one that was recommended is, I believe, 30 square feet every 30 feet, and they're trying to reduce the grid for sampling, for soil sampling, for contaminated soil sampling, which makes sense. And the other longer discussion was about the holding basin wall design. That this has been such a long project that the original design that was discussed and I think approved some time ago, now they have new technology, new idea, new design. That sounded like it might be less, I don't want to say less effective. So the original one was to build a wall that went right into the bedrock. Now it's being recommended that they stop short of the bedrock for this holding basin wall. So I think the committee felt that it was worth exploring both options, holding off on design instead of this kind of perhaps less effective or newer technology way of stopping the basin wall before the bedrock, that there might still be some leakage out. So,
Interesting.
and they talked, for my benefit, they talked a little bit about the leakage that has occurred, how it approaches the Assabet River, how it goes under the Assabet River and approaches the Acton drinking reservoir. So that was interesting that that's the way the plume can travel. In addition to having some contaminated soil in the area all around nuclear metals. So very educational, lots of topics, and such a very dedicated committee.
Well, thank you very much for being our representative to that committee. Very appreciated. Excellent. Any other board member reports? Great, hearing none. Why don't we go on to the public health director report?
Great. So what I'd like to do first is go through what were actions, and then I'll go through each of the like kind of update on what we're doing, and then we'll go into the specifics of each of the regulations that are attached, like, because I think I want to separate it. So the first thing I want to report on is week before last, I presented to the Concord Fire a clutter image rating scale training to the Concord Fire, and we'll do that again to police, and we'll do that again in Lincoln. The clutter image rating scale is a tool we use in housing to get people that might go in to understand what something might, lots of stuff on the floor, or might be unclean, but really where it's a point of risk. So they can come away with a number, like a way to write the report and say, I saw that this was a number 6 on the clutter image rating scale. Then that can translate into a concern for a housing case. That's a follow-up of a case we had in Lincoln, and some just feedback from police and fire, and working with those partners on how we get involved with housing complaints if they come in through a rescue or a call. So I had a couple just to look at. I'm gonna want those back, but we printed those up. Ebony worked to get those print, and we're giving them to police and fire cruisers, just to provide training on the correct terminology around what reporting as a diagnosis, and what to look for, what to write, and what's helpful for us for the housing code. On Friday, we're going to give another round of the emergency preparedness talk at the library with our partners with fire. Just talking about emergency preparedness, as September is Emergency Preparedness Month. We have model kits that were given out through the Council on Aging, backpacks for emergency preparedness for a grant we received last year. We had about 50 backpacks that we gave out. We don't have any more of those backpacks, but we're still talking about you can make your own in emergency preparedness and being, sheltering. A lot of talk and activity kind of ramping up. The town manager's office, just so you know, is having us meet bi-weekly, and we will pretty quick start meeting weekly as town staff around the 250th. So there's a lot of 250th committees in the town level. Where health gets involved is our food truck, food safety, things like porta toilets and water and trash, and but we will be permitting all the food vendors that are temporary or mobile food permits. So that how we're going to do that, how those are set up and vetted and then permitted, we will be working actively on as a division. So that's becoming more active. If anybody have any questions on that, we have a permitting process and permitized, but we still have to figure out how we're gonna, who wants to sign up and how we're gonna, how to get what the committee's looking for. That's the 250th committee. And then we have we have a flu flyer that's been worked out by our Great Meadows. So we're talking and advocating for flu. And making people aware beyond we had some feedback about vaccines from one of our critics of vaccines. We actually thought it was good feedback about, besides just get your shot, about just general precautions.
Sure.
Right? Hand washing, covering your nose and mouth, good nutrition, we thought that was good feedback. And we wanted to, that's a good point. It was a vaccine critic that presented that to us, but we did feel that was good messaging, so we're kind of working on, we included, we took that in stride. And we did do, as requested by the board, a EEE flyer that I sent out to all of you. With, again, more about precautions and trying to get people aware and up to speed on what they can do to protect themselves against mosquitoes. You know, just because we reduce our strong recommendation, doesn't mean we want people to get bit by mosquitoes for a little bit, if they can help it. Any questions on anything, any of those items?
Are you gonna have to redistribute this if we go down,
Yep.
from the strongly?
We will. Important staffing change, we have Ebony's gonna be on maternity leave, starting in a couple weeks. And we have Ariana White will be starting as a temp to be trained on Wednesday, is the plan. She's coming from a temp agency and she will be here as a temp filling in. Ebony's still slated to be out 12 weeks. So she'll be assisting in that interim.
Great.
We'll be starting to train her and work on that. Any other questions on just Board of Health day-to-day operations?
I don't know if probably next meeting, we can discuss the calendar for next calendar year
Mhm.
for meetings.
Yep, sure.
Yeah, so we can add that as an agenda item, I suppose.
Yep,
Just
we
have
will do that.
Yeah,
That's good feedback.
Great.
Generally,
does it work to keep on Tuesdays or we could, I heard that you work
Yeah.
most Tuesdays. so
Yeah, I
we
work
could-
all Tuesday, so
yeah.
I'm actually, Mondays work better for me right now, but again, you're the,
Well,
chair, so like,
can
so,
potentially modify as well. so,
oh, really?
Yeah,
Mhm.
yeah.
And would it be difficult for either of you, or
No, that would be okay. with-
Mondays are okay too?
Yep, that works.
Oh,
Okay.
Yeah.
So, so why don't we,
That'd
if possible, we only have 3 weeks before the next meeting, so we're
Yeah.
at the end of the month now, but
Mhm.
so maybe we could, send out, modify the meetings to Mondays and then,
Yeah, that's great.
send it out.
what we'll do is we've done in the past is we do a draft calendar for the entire of next year.
Okay.
And then we ask you to look at your calendar, double check the dates. And sometimes if we switch to a Monday, it's a holiday, so we
Right.
just have to then we'll move it if it's a holiday, just so you know, it'll be a little bit. But we can keep it on a Monday, we just might not be the third Monday, but the third Monday is a holiday. Might be the fourth, so we'll kind of have to take a look at
Sure.
that.
Yeah. that'd be great.
So that, and then room availability, so I think the room is available on Mondays, so, but I'm not 100% sure, that's the other dictating factor is space. But yeah, we'll have a draft calendar hopefully, and then we can get feedback on it.
Great. Excellent. And we'll keep Tuesdays for the rest of the calendar year, I suppose, just because, it's set already, unless. I don't know, actually, could be, well, next, the,
14th is a holiday,
14th is
so that's
Mother's
to my
Day,
point,
yeah.
the 14th is not a
Right.
work day for us.
Yep, yep.
And then.
And yeah, actually, so let's keep October as is, and then maybe we could discuss, maybe with the calendar send out, maybe we could look at November on.
Yeah, sure.
Yeah.
We
That'd be
definitely
good,
can.
yes.
We definitely can do
It's on
that.
a Wednesday, if I'm not mistaken, this year too,
Okay,
so it would be Christmas Eve would be in December. Oh, I don't know, yeah.
I have
That's
to-
the last. I would imagine we would have already set that up anyways.
we
but-
did set it, but we can revisit anything.
Yeah,
Yeah,
As a board. It's usually I work Monday and Tuesday, so it doesn't
Yeah.
matter to me.
Sure.
Um, it's just a matter of availability of the room and I like to get it, ideally everyone to be able to attend. I mean, things come up, but if you always work Tuesday and Kurt, I know has a conflict with another committee on Tuesdays until it's done. So it's be helpful probably to him to, have Mondays. That way he doesn't have to pick between 2 committees and we're the more important one, just saying.
Would Wednesdays work for your,
I could do Wednesdays too.
yeah?
Yeah.
Because then we would be less likely to run into Monday holiday issues, I suppose,
Yeah,
but I don't know how that would work. for everyone else.
I don't know the Wednesday meeting schedule in this building.
Okay.
So
Mhm.
that, we've only, but I can look into it.
Sure.
Like, anything I can, but I'm gonna have to like. Before I commit to
Right.
anything for the
Yeah, yeah.
board, I need to look into that and know what I'm saying. Oh, sure, that sounds good. And when actually there's no space.
Right,
And then it just becomes a lot more cumbersome, not impossible to find a room in another building.
Yep.
We can definitely do it, but it becomes kind of a,
not ideal.
we have more pull in this building versus another building.
Sure.
Keys to have access, the whole thing.
Yep.
So there's two things. I'm gonna start with the body art establishment discussion, because I think that will be, this is a existing regulation that's on our website, but there's about 3 edits. The first one is on page 6. Where we're adding, tattooing may not be performed under the age of 18. That's the first change. What I'd like to do, and I'd like to propose, if the board had no additional questions or changes, to post this. And then have it at the hearing be next month, but if they're not comfortable with that, then the changes, then I have to post it to the public. And inform our in this case, the, tattooing
Step.
practitioners, establishments, I let them know of the change and then let them have the opportunity to have feedback.
Is that state law?
It's a state law.
Yes, okay.
It was just the way it was a oversight on our part to not put in there specifically that it's forbidden, because, and that came actually feedback from one of our test establishments that said, just Melanie.
Right.
Just so you know, like this, if you read it and it reads like this, I'm like, oh, I didn't intend to contradict the state. And we can be more strict than the state, we can't be less. Right, that's the way the regulations go. And then on page 18, we never set the actual fee for the permit. And we had a discussion at the time, fee for a short-term permit and a long-term permit. And what I'd like to do, instead of setting an amount, is let us decide with approval of the town. The town manager sets all fees anyways, but the board to say, yes, we can set the fee with the town manager approval. That's a proposal. Versus saying, we will charge 150 and we decide to raise it.
Right.
And we go review all our fees, and then I have to go back to the board, update this reg to change
Mhm.
the fee. I like to put it like that. And then, the last one is on page 25, where we're just kind of defining for violation, the fee schedule. And that's kind of outlined with our fee schedule in Mass General Law. The $100, $200, and $300 fine. That would be per violation per day. But that's the proposal.
I feel like we did discuss that the last time, didn't we?
We
Oh, was
just-
that the cigarette? It might have been the cigarette.
It was a cigarette, it was the
Yeah.
tobacco, it's,
Similar, but
this is.
We never put it into language.
Was never written into the language.
Yeah.
Okay, of the reg, so that it was kind of left hanging and it needed to be, I just. In any case, if anyone ever gets a fine, they can appeal to the board, like they can come and they can appeal.
Mhm.
Right, that's their right, so they would appeal to us and then come before you at a meeting.
the line about fine for practitioner practicing without a license shall be $6 per day, that's removed and not needed.
We're not gonna, it'll be. $100 per day per,
Regardless of what the offense
right,
is.
they'll
even
get
if-
an order letter, you're operating, you must, and then it's the, first we issue an order letter. And say you must get, and then we start saying it's gonna be per day.
Cause it seemed previously that there was a separate thing, $150 for a violation and then $600 if you were practicing without a license. We're doing away with that.
That's the way we wrote it, we
Okay.
could put it back. As like, if somebody's practicing
There was
without a
also a
license.
question about getting the license or how difficult it was to get the license in this particular. I don't think it was for tattooing, but it was for the makeup.
So we had semi-permanent makeup, so we had a
Yeah.
practitioner discuss and have feedback about getting the hours as an apprentice for semi-permanent makeup. She was pushing back on what we set for guidelines in here
Right.
for semi-permanent makeup.
Is this the reason why we're taking out the 600?
Yeah, I mean, we're saying we want people to comply. The goal is to compliance to get a permit and be adequately trained. If $100, even let's say they don't have a permit and we suspend their permit and give them a cease and desist, which is what I did before, right?
Mhm.
And then they decide to not it's $100 per day, right?
Mhm.
If they don't comply. If they comply, usually we give them so many days to comply.
Okay,
And if they don't do that, then we bring them before the hearing, before the board
okay.
with a fine, and issue them like a fine. In my experience here, we've not really ever fined anybody in the 2 years I've worked here for anything. Doesn't, not saying we won't. It's more effective to have a hearing before the board,
Sure.
That's fine with me.
but sometimes people don't renew their permit and we'll say $100 per day, right? They're not renewing. And then we don't hear from them in 2-3 weeks. We're like, now you're at $200 per day because you're not responding to us,
Right.
right? We're trying to get them to want to comply.
Sure.
In the other cases where, let's say they were missing, you went in and there was a hand sink. And you asked them to correct it and they wouldn't. First, you're gonna issue say, correct this, and they don't, then you'll fine them. Then you went back and the inspection another time and then you had to do it, they still didn't have a hand sink. Well, then you're gonna start, that's when you would start to fine. It's after you've given them a chance to correct and they still don't. In most cases, if it's severe enough, then you're going to, order them before the board. It's a cease, because it's unsafe that you give them a cease and desist. They operate without a permit.
Yep.
But some of the things in here, if somebody refuses to comply with like the training requirements, we give them an order letter and then say, by this date.
Gotcha.
So I would entertain a motion to post this regulation update as written to be voted on at a public hearing at the next meeting.
I second this.
Great, okay.
Second
So,
also, second or second.
perfect, alrighty, and we'll go ahead and take a vote then, so all in favor?
All right,
Aye, and Kurt?
Aye, in favor.
Excellent, thank you, everyone.
Right. And the last one is the
Yes.
tobacco-free generation regulation. This is a draft regulation. We've been working on, it's been reviewed by town council and it's in its state, we believe, ready to post and share with the public. So I wanted an opportunity to have you review it. We need to post it. You've seen it before. We need to post it pretty quickly because we need a minimum of 2 weeks. Like if you approve it, we need to post it with the Concord, put it in the Concord Bridge and post it and send it out to the tobacco retailer so they have sufficient notice before the next meeting because it's 3 weeks.
Mhm.
So we're looking to get that out and in a timely manner.
And the big change compared to the prior reg is
This,
section D.
right,
Correct, okay.
tobacco-free generation. So
Yeah.
page 5. This is the work where as of January 1st, if you turn 21, you still won't be able to buy, and then therefore ever after. So in 10 years, nobody in their 20s would be able to buy.
So the generational approach.
Correct. It's called the tobacco-free generation
Mhm.
regulation.
And as the board may recall, we have kind of, instead of going straight to a no tobacco sales in the town, kind of weaning it out over time.
Mhm.
And without putting an undue hardship on those who already are addicted to tobacco.
And maybe easing it for the vendors as well, for them to get used to increase in tobacco sales.
Indeed.
I believe you will have some feedback from retailers about that.
Were there any other changes? So, is it really just section D? So the remainder? of-
From the whole big, from original
Yes,
regulation,
uh-huh,
there
yep.
was some changes to the cigars and we had a little bit of
Section.
word, right, a little bit of wordsmithing, and some terminology. So
Okay.
the cigar sales and the pricing and what the definitions, and that was the bulk of the changes.
That's good. Well, I would entertain a motion to publish this updated regulation for public hearing at the next meeting.
I moved to publish it.
A second.
Excellent. And all in favor? All present and Kurt. Wonderful.
Yeah, I'm in
Unanimously
favor.
approved. All righty. Excellent. Anything else from your?
That is,
Director report.
that concludes my director's report for tonight.
Wonderful. Thank you very much. So final part of the meeting is a period of public comment. So we'll open the discussion to any members of the public present who would like to make any comments. I would ask that anyone who does wish to speak, please limit your comments to a period of 3 minutes or less. Okay, well, hearing no public comments present, I would entertain a motion to adjourn the meeting for tonight.
I moved to adjourn.
Excellent.
Second.
All in favor?
All right.
Aye.
Hi.
And Kurt? Excellent. All right, well, thank you, everyone.